Hi, I'm Dr. Sebastian Gonzalez with Performance Play Sports Care again. If you've not watched our other videos, feel free to do so. This one is going to be a continuation of our series on doing some very quick stuff in regards to keeping the research current and getting you guys educated about the types of conditions and treatments you might experience out in the field. So this one is actually a fairly recent one. This is 2015. I believe it was August or November-ish in the Journal of Strength Conditioning Research. It's called the Functional Movement Screen, or FMS, for those of you who've heard the Functional Movement Screen, for predicting running injuries in 18 to 24-year-old competitive male runners. Now I'll bring it up to the screen here so you can see again, just as always. Try that one on for size. So check that out. A lot of times you can get the abstracts online for free. We'll get, actually, if you're a member of the NSCA, you'll get this one for free, the complete text. So the reason I thought this one was going to be interesting to put out there is because the FMS is a very common thing used now for assessing injuries and predicting injuries, we say. And just as always, I'm going to be presenting the ideas on this paper. I'm not validating or bashing any of this stuff on here. It's just basically presenting what's in this research article that was presented in front of me. So this one, for those of you who don't know, the FMS consists of about 7 tests. It tests between asymmetries and compensatory motions that you might see as the examiner. You might have someone do a deep squat, and you'll see them do some knee cave, some forward lean, things of those nature, and those will basically change the score and make you feel that or assess the athlete and say that they have a higher potential of injury because of X, Y, and Z. So they found actually that FMS scores that equal or greater to 14 have a higher risk of injuries. And in this study, they actually used, let's see, I think it was a significant amount of runners. I think it was 101. So 101 runners from 7 teams participated in the FMS, but only 84 of them returned. So you can only get stats on those ones. So they actually found that the inter-examiner reliability of the FMS, it was 0.98, so demonstrating excellent inter-examiner reliability. So I know that's something that's been questionable for some people, is that how well have these people been trained, and they might, because it's all visual, well, that's a lot of times it's hard for the athlete to see. Now, it was interesting to see that this study found that there was only a few tests in the FMS which were really, really valid in predicting injuries in at least these male runners from 18 to 24. So they actually found the deep squat and the active straight leg raise are ones that are the most valid. And they're positioning this paper here mainly so strength coaches, because that's what this journal is usually used for, they can use this as a screening tool. It only takes a few minutes to assess these athletes and see whether they test very poorly on these. So I believe actually back in there was a good stat in here. I believe it was that so if they tested lower than 3, greater than equal lesser or equal to 3 on the deep squat and active straight leg test, they're approximately 10 times more likely to have a running injury than those who tested a 4 or equal or greater to, or greater than or equal to 4. So I think that's pretty significant, quite honestly. And I know there's some coaches out there, at least in regards to high school and college running coaches, where not all of them are allowed to assess their runners before they come in. But I would imagine dropping a pen on the ground would be a nice thing to see how they drop into a squat. A lot of times you can see whether this person is going to be a productive runner for your team, for your school. So the purpose of this study was to investigate with the FMS, or functional movement screen, could predict running injuries in competitive male runners. They found, the subjects that performed the best on shoulder mobility, which basically requires the shoulder and scapula and thoracic spines to all work in combination and work very well. And this is needed so when the runners have arm swing, there's no resistance to it, because arm swing is obviously needed with running. They tested the worst on rotational stabilization. And if you don't know what rotational stabilization is, it's required for stabilization of the trunk in multiple planes. And the core works in 3 planes or 6 ranges of motion. So we have forward, backwards, which is sagittal, side to side, which is frontal, and rotational, which is going like this. So they concluded that actually the rotational stabilization test was one of the most difficult ones of the FMS. So what are the correlations of these tests again? Because again, they found that the deep squat and the active straight leg raise were the most valid in predicting injuries in this group of athletes. So they're saying that the deep squat assesses bilateral symmetrical mobility, especially mobility of the hips, ankles, thoracic spine, and coordination of closed chain or a closed kinetic chain motion. Active straight leg test was found to, let's see, basically they require, so it assesses hamstring length as well as gastroc and soleus length, but also they have to maintain a stable pelvis when it's conducted as well. So I think that's a good assessment of core strength as well. So this test, how do we use this paper to improve our care, at least as healthcare providers or sports injury professionals? I think it's good to bring this attention to patients when they come in. If they're not in pain anymore, and this happens a lot in many types of clinics all around the world, I'm sure, a lot of patients see pain as the reason why they come in, start care, and then stop care as well. And I had actually a patient just today. He got out of pain, and he came in, and he's like, "There's nothing wrong with me." And I'm like, "Well, have you been doing your rehab that we talked about?" And he said, "No." So he basically was not adding that to his program, so his movements have probably become poor. We actually didn't have the opportunity to even test him because he wanted something else done, which, again, the customer is always right. But I think that we have a responsibility as healthcare providers to show these people beginning baseline testing as well as follow-up testing after they've gotten rid of their pain, because we all know that pain is just the first thing to go, last thing to come, and movement dysfunctions a lot of time are very, very prevalent, and in this case predictors of injuries, and that's what the FMS is mainly about, and a lot of these screening tests that there are out there again. They're looking at predicting injuries. Can movements predict injuries? And I think that they can, and I know a lot of other healthcare providers think that we can too. So I hope this was helpful. Again, check this study out. It is on the Journal of Strength and Conditioning Research, and again, it's called Functional Movement Screen for Predicting Running Injuries in 18 to 24-year-old competitive male runners. Check out our website as well as our podcast. That is Performance Plays Sports Care on the podcast, and if you go onto our website, it's p2sportscare.com. Watch the next video and talk to you soon.